Cubalah bagi background blur Indra.
Ha? Boleh dah? Okay, Assalamualaikum and hi to all my students.
Waalaikumsalam warahmatullahi wabarakatuh, sir.
Waalaikumsalam, sir.
How are you today? Are you
Good,
fine?
sir.
Oh, in the pink of hair.
Does anyone have any sickness or anything like fever or something else?
No, sir. I think you
Okay,
have.
I hope you all doing fine today. But first, I want to say sorry because I'm not feeling well today because I have sore throat. So, uh, when I'm teaching you after this, if you can hear my voice clear, just raise your hand and ask me. Okay.
Okay, sir.
So now let's go to our topic today. Okay, I'm sorry. For today, you will learn about T.O.T.A.P.S, a quick guide to sport injury assessment. Do you know what is T.O.T.A.P.S?
No.
Don't
No,
know,
sir.
So okay, that's fine. Okay, I will teach you after this. But before that, I want to show you my rules in my class. The first one is please always focus during the lesson. Either you can take some notes for the lecture, and then the second one is please raise your hand to speak. If you have any question or you can hear clear, so just raise your hand, okay? And then the third one is please always turn on your camera. Okay. Okay. So for objective for my class today is the first one. I want all of you to understand about the procedure of T.O.T.A.P.S, the all procedure of T.O.T.A.P.S. And then the second one is I want to all of you please apply what you have learned for today. Okay. Especially for the first aider. Okay, so now I will teach you about T.O.T.A.P.S. What is T.O.T.A.P.S? T.O.T.A.P.S is the acronym for a five-step process to assess soft tissue injuries. Okay, now what is the function of T.O.T.A.P.S? T.O.T.A.P.S helps determine the severity of injury and next steps. And then what is T.O.T.A.P.S? So, as you can see here in the slide that I provide for you, these are the steps of doing T.O.T.A.P.S. The first one is, as you can see here, the first one is talk, and then the second one is observe, third one touch, and then active movement, passive movement, and the last one is skill test. Okay, so let's go for the first procedure for T.O.T.A.P.S, which is talk. Okay, when you go to play sports, you will get a chance to get injury, right? Is it correct?
Yes. Yes.
You will have a chance to get injury. So these procedures can help you as the first aider to to lower the chance of injury. And then the first one is talk. When injury occurs, the first thing you need to do is you have to talk to the person. You can ask what happened to them, and then the second question that you may ask is where does it hurt? Because like you are going to play futsal and then someone have ankle sprain, and then you go to them and ask them what happened. And then the last is do you hear sound like popping or something else? And then that is for the first procedure, and then we go to the next procedure, which is observe. So as the first aider, you have to look for visible signs of injury, just like swelling, bruising, or bleeding. So you can observe the injured person. I'm sorry. Okay, the third one is touch. You can gently feel the injured area. If like ankle sprain or muscle strain occur, you can touch the injured area to check for tenderness or pain points. You can touch and ask the patient, when I touch here, does you feel hurts or not? And then you, if they say no, and then you touch the other part and ask the same question to check for the pain points. Okay. uh as a reminder, please always make sure that your hand are always clean, to make sure that you can reduce the chance to get another disease like infection or something else. Okay, are you okay, my students?
Yes, sir.
Yes,
Okay.
sir.
Okay,
Yes,
good.
sir.
And then the next procedure, which is active movement. Active movement is you have to ask the injured person or athletes to move the injured part themselves. Maybe like if someone just facing ankle sprain, and then you go to them and then do the first for three procedure, and then for the fourth procedure you ask them to move themselves. You ask to move them their leg themselves, and then ask them, is it if he or she okay or not, and then you also look if they can move by themselves. So the main important thing for the active movement is you can look at the range of motion and the presence of pain. If like she or he raise her leg after the ankle sprain, maybe it can lead to the pain. So you need to take aware and look carefully for the active movement. And then we go to the next one, which is the passive movement. If they can't do the active movement, you need to carefully move the injured part by yourself. Means you help them to move the injured part. This can be used if you has observed them and they cannot do the active movement. Okay, so for the last procedure for the T.O.T.A.P.S is a skill test. And then after you have finished the talk, observe, touch, active, and passive movement, uh, you need to ask the athlete to perform a skill that related to their sport, like jogging, jumping, kicking, or throwing, so that you know, you can observe whether they are still can continue for to play or cannot. Okay, do you understand?
Yes, sir.
Yes, sir.
Yes, that's good. Okay, so now that is the procedure of the taps. We go for the important of TOTAPs. The first one is quick and structured on-field assessment. TOTAPs provide a systematic way to assess an injury right after it happens. So by following the procedure of TOTAPs, you can observe and know either the player can play or not, and then it helps responders make quick, informed decision instead of guessing. Okay, the second one is prevents further injury. Early detection of signs such as swelling, instability, or restricted movement prevents the athlete from returning to play too soon. means once injury occurs, the athlete must take a rest, and then by doing the T.O.T.A.P.S procedure, you can give some information or words to them to make sure that they really understand about the injuries that occurred to them. Okay, so the here is we want to reduce the chance to get the further injury. Maybe when the injury occur, the player said that, oh, I can play after this. But by doing the T.O.T.A.P.S, you can tell them that whether they are can play after that or they need to take a rest first. So we go for the third point, which is the promotes athlete safety and confidence. So athletes feel safer knowing they are properly assessed before returning to the action. As I said before, you need to observe your patient to make sure they are ready to return for their games or not, and then reduce pressure on athletes to play through injuries. And then the last one is help differentiate between minor and serious injury. Simple discomfort can be distinguished from sprain, strains, fractures, or ligament damage. So, based on the outcome of the stats, you can decide if rest or ice is enough or if medical attention is needed. So, by doing TOTAPs, you can differentiate whether your patient get the minor or serious injuries so that you can tell them about the all of the information for the injury that occurred. So that is the importance of TOTAPs. Okay, so we have done our lesson for today. Thank you, all of you, for focusing on my class. And then I have provided to all of you the quizzes. So now, but I have given you the link, and please open the link. Oh, my connection is quite slow. It may take some time. Okay, now I'm waiting to for you to enter the the quizzes. Okay, Maria, Cristiano, Gabriel, Omar. This is a live quiz. Okay, so I want to wait to all of you to get ready first. Three participants. So where is the others? Irfan, are you okay? Khairul Irfan.
Wait, sir. Wait, sir. Wait, sir. I'm
All
trying
right, take
to.
your time. So I have provide to all of you the quiz about the T.O.T.A.P.S topic. And then where is Afif? Afif, where are you? Maybe he got the slow connection. I think it's okay. Can I start the quiz?
Yes, sir.
All right. Okay, as we can see here, Omar is leading right now. Okay, Kai. Make sure that you remember all the things that I have teach you. I have taught you. Okay, for question for Kai. Okay, Kai still leading right now. Cristiano Gabriel for the second place. Are you okay? Students, are you okay?
Okay, sir.
Okay, sir. Okay, Mario and Gabriel have finished answered their question. So Umar and Kai left here. Okay, all of you have finished the answered the question. So let's end the game. Okay, so the third place is Omar, the second place is Cristiano Gabriel, and the first place is Kai. Give all of you a big clap. So now I want one of you to recap what we have learned today. Can I call Maria?
Yes, sir.
Please, can you please recap what you have learned for today?
Firstly, I learned about what is acronym T.O.T.A.P.S, which is talk, observe, touch, active movement, passive movement, and skill test.
Yes, exactly. Perfect. Give Maria a big clap. Okay, then what do you have learned more after the TOTAPS acronym? You also learn about the importance, right? Okay, give
Yes.
me one importance of TOTAPS. Umar, can you answer my question?
To prevent the athlete from the serious injury.
Perfect. Give Umar a big clap. Okay, so by recap all the lesson that you have learned today, so that we finish our class now. So thank you to all of you for coming to my class for today, and I hope you will learn something from the lesson today, and I also hope that you can apply the procedures that I have taught you in the future. Okay, so
Okay, sir.
that's all from me. Thank you.
Thank you,
Thank
And
you,
sir.
sir.
Assalamualaikum
Thank you,
Thank you,
warahmatullahi
sir.
sir.
wabarakatuh.
Waalaikumsalam.
Waalaikumsalam.